Hello, everyone. Welcome to the Zoom webinar. My name is Marcin. I'm FM World UK product trainer. And today I will tell you about a very important subject, which is bone and joint health, and also which Nutricode supplements you can take to support it. So let's take a look. Here's what you're going to learn during the webinar today. So first of all, during the first part of the webinar, you will learn about bones and joints. I will tell you a few important and fun facts about joints and bones. Next, you'll find out what conditions may affect joints and bones. It's crucial to know that, because if you want to become our Nutricode expert, it's very important, because one of your potential customers or your customers may ask you some of the questions, or they may deal with some of the conditions I'm going to introduce. Then I've put together some scientific evidence and prepared a 10-step guide on how to build healthy bones and joints. I'll also tell you, which is the most important thing I think during the webinar, which Nutricode supplements can help strengthen your bones and joints. I put two options because there's more than one supplement that you can use in order to improve joints and bone health. Okay, so let's get started. So if I ask you to think about your overall health, what would you think of at first? Just think for a moment. Perhaps it would be your heart or lungs or kidney or even liver, maybe stomach. If I keep asking you, you may think about your skin or your eyes. But what about your joints and bones? They are very often become neglected, and then we can see so many older people struggling with walking and pain. After the webinar today, I guarantee that you will think about your bones and joint health more often and more carefully. So today you are going to learn about joints and bones anatomy and how important they are. I will introduce to you bone health basics. You can expect to get some tips and advice on how to build healthy bones and joints, and how to keep improving the health of those anatomical structures. Because obviously none of us would like to suffer any pain, discomfort. We don't want to experience any dysfunction that may affect joints. And there are quite many of them. They can be prevented, or at least the degeneration can be slowed down. So let's take a look. There are over 360 joints and 206 bones in the human body. So normally when we think about joints, we think about elbows, knees. Yes, these are the biggest ones, but there are some small joints along the whole spine, and they work in order to perform a particular action. So these are joints as well. So 360 joints and 206 bones in the human body. They work together to give us the ability to walk, run, jump, and move around. Joints are surprisingly complex. We think it's just a hinge, but it is not. They're made up of a network of muscles, tendons, ligaments, bones, and nerves that work together to keep us moving. So what actually makes up a joint? Our bones make up the foundation of our joints. Joints are the place where two bones meet or connect. So let's learn about the important parts of joints, such as ligaments, tendons, and cartilage. Ligaments, for example, are short bands of tough fibrous connective tissue that connect one bone to another, forming the joint. Tendons are made of elastic tissue and also play a key role in functioning of joints. They connect muscle to bone. And finally, cartilage is the cushion or buffer that provides a smooth surface around our bones to stop them from rubbing against one another. It acts like a shock absorber by helping minimize the impact of movement. When cartilage starts to erode, it causes our bones to slide against each other, which can lead to pain. This is arthritis. This is a very, very painful condition. It can be very painful. The important thing to know about cartilage is that once it's gone, it does not come back. That's why people need to have knee replacements. So it's vital that we take steps to take care of what's already there. You know that muscles, tendons, and even ligaments may heal, but why is it difficult for cartilage to heal? It's because cartilage doesn't receive a blood supply. Cartilage damage causes joint pain, inflammation, swelling, stiffness, and also reduced range of movement. So we don't move as much, we become rigid. Once the cartilage is damaged, the quality of life is never the same. Some joints move and some don't. Joints in the skull, for example, don't move. And synovial joints, like our knee or elbow, are movable joints. So now let's move on and learn a bit about bones. So what do bones do? Bones serve many vital functions in our body, and some of them may be a little bit surprising as we never think of them. So first of all, bones support. Bones provide a rigid framework as well as support for other parts of our body. They provide also movement. So that's why we can move our body. They transmit force of muscle contraction. So muscles contract via tendons, and when your muscle contracts, your bones act as a lever, while your joints form a pivot point. And that's how movement is possible. They also provide protection. Your bones protect many of your internal organs. Good examples of this include the way your rib cage surrounds organs such as your heart, your lungs, or how the bones of your skull protect your brain. Also, the many cells of our body, like red blood cells, white blood cells, and platelets, are formed inside our bones. It occurs in a part of the bone called bone marrow, or red bone marrow, for example, where the red blood cells are being produced. And it also provides storage. Important minerals such as calcium, phosphorus are stored within our bones. When your body needs more of these minerals, they can be released back into the bloodstream for us. So it is crucial to make sure you have enough of these minerals inside your bones. In addition to red bone marrow, bones also contain another type of marrow, which is called yellow marrow. This is where some fat tissue is stored. The fats in this tissue can be broken down and used for energy later on if required. So bone is a living tissue. It's not something dead, as sometimes we may think. It contains different things and also renew every now and then. So basically, the peak bone mass usually attained by our 30s. Peak bone mass is the point when bones reach their maximum strength and density. After the peak, the bones start to become weaker and weaker and weaker. About 10% of our bone mass is replaced a year, and every 10 years, approximately, your whole skeleton is replaced. Calcium, as you know, is the most abundant mineral in bone. And it has been estimated that the average adult skeleton contains one kilogram of calcium, and that is 22 pounds of calcium inside your bones at this very moment, providing your bones are strong and healthy. So then these are the figures. So since you now know what bones and joints are, let's have a quick look at the conditions that may affect them. There are many different conditions and injuries related to bones, muscles, and joints. And some of them, for example, include back pain. So we are all familiar with that. Back pain can be related to muscular tension caused by stress, problems with discs, degeneration of the discs, and spinal stenosis, which is the degeneration of the vertebrae. So spinal stenosis occurs when the space around your spine cord narrows and causes pressure on your nerve roots. The main cause is wear and tear, arthritis or osteoarthritis. As cartilage wears away, bone rubs against bone, and this can result in overgrowth of bone, which is called bone spars, and that goes into spinal cord space. Other causes of spinal stenosis include herniated disc, thickened ligaments, and abnormal growth of the bone. So osteoarthritis, which is a common cause of arthritis, is sometimes called degenerative arthritis. This type of arthritis results from wear and tear on joints. Cartilage, thin tissue that protects bones in your joints, wears away with use. Over time, the cartilage can no longer protect your bones, so then it causes pain as the bone rubs against another bone. So OA can affect any joint in the body, but most often affects the knees and hips and fingers, neck, and back. As OA progresses, it can begin to cause symptoms other than just stiffness, and these may include pain, swelling, cracking sound when you move the joint, and many others. As the condition worsens, your bones may break more easily, and you could develop bone spars. In advanced stages of OA, the cartilage disappears completely. Bones rub against another bones in your joint, and that creates extreme pain, stiffness, and disability. Everything can be prevented, at least slowed down, because we all are getting older. So the degenerative changes will take place, but with proper diet and supplements, everything can be slowed down or prevented. Another condition is osteoporosis. Osteoporosis is a health condition that weakens bones, making them fragile and more likely to break. Osteoporosis is not painful, and that is why many people do not even know they have it. It develops slowly over several years and is often only diagnosed when a fall or a sudden impact causes a bone to break. You can see in the picture how osteoporosis affects bone mass. You can clearly see that. And a lot of elderly people, when they fall, they usually break a hip and or a knee, and they hurt the knee, and that is because of the osteoporosis. Women are particularly at risk. The next condition is called rheumatoid arthritis, RA. RA is an chronic inflammatory disorder. It's also an autoimmune disease. This means that your immune system attacks healthy parts of your body, such as the lining of your joints. This causes inflammation, pain, and stiffness. Over time, it can also cause joint deformity and bone erosion. Another condition that may affect our joints is sprain. A sprain is an overstretch or tear in a ligament. If your ligaments are strong and healthy, they support your joints and they are less likely to be injured. If your muscles are weak or overused or overloaded, if you really work hard at the gym and your muscles are not strong enough, a muscle strain or turn, can happen. Muscle is a soft tissue, so it's called a soft tissue injury. The best way to prevent these musculoskeletal illnesses and injuries is to eat a healthy diet, take dietary supplements if you are not able to provide sufficient amounts of nutrients through your diet alone, and be as active as you can to keep the healthy weight. So, building healthy bones is extremely important. Minerals are incorporated into your bones during childhood, adolescence, and then early adulthood. But once you reach 30 years of age, you have achieved peak bone mass. If not enough bone mass is created during this time, or bone loss occurs later in your life, you have an increased risk of developing fragile bones that break easily. Fortunately, many nutrition and lifestyle habits can help you build strong bones and maintain them as you age. So here are 10 natural ways to build healthy bones, and everything is based on scientific evidence. So number one is eat vegetables, eat lots of vegetables. Vegetables are great for your bones. They are one of the best sources of vitamin C, which stimulates the production of bone-forming cells. In addition, some studies suggest that vitamin C's antioxidant effects may protect bone cells from damage. Vegetables also seem to increase bone mineral density, also known as bone density. A high intake of green and yellow vegetables has been linked to increased bone mineralization during childhood and maintenance of bone mass in young adulthood. So since joints contain a lot of collagen-rich connective tissue, they can also be affected by vitamin C deficiency. There have been many reported cases of joint pain associated with vitamin C deficiency, often severe enough to cause limping or difficulty walking. Bleeding within the joint can also occur in people who are deficient in vitamin C, causing swelling and additional pain. Yet, both of these symptoms can be treated with vitamin C supplements and commonly resolve within 1 week. So for joint health, I would suggest taking our liposomal vitamin C. Vitamin C is a powerful antioxidant that plays an essential role in joint health and immune function that may benefit people with arthritis. A lot of research suggests that vitamin C may ease pain, reduce inflammation, and also protect against cartilage damage associated with rheumatoid arthritis and osteoarthritis. So vitamin C may protect against the development and progression of OA and RA for a variety of reasons. So first of all, vitamin C is a powerful antioxidant, as I mentioned, that fights molecules that trigger joint inflammation. Also, it serves a role as a cofactor in collagen synthesis, the main protein in joint tissue and bone. Is also good for the skin. Vitamin C also plays a role in fighting infection and may work to control inflammation linked to infection, which may trigger arthritis flare-ups. In addition, vitamin C appears to moderate the autoimmune response in rheumatoid arthritis and help prevent a worsening of the chronic condition. So that's number one, and vitamin C would be definitely the supplement that everyone should take, not only for general well-being, but also to look after, protect the bones. Okay, next, take collagen supplements. Early scientific evidence suggests that collagen supplements may also help protect bones, and they are crucial in bone health. Collagen is the main protein found in bones. It contains the amino acids glycine, proline, and lysine, which help build bones, muscles, ligaments, and other tissues in our body. Although most studies have looked at collagen's effects on joint conditions like arthritis, it appears to have beneficial effects on bone health as well. So there was a study done on postmenopausal women with osteoporosis, and when they combined a collagen supplement with a hormone, calcitonin, that led to a significant reduction in markers of collagen breakdown, which means that they were able to keep their bones stronger, and the osteoporosis was kept in bay. So take a look at the Nutricode supplement that can help you strengthen your bones, joints, muscles, ligaments, and tendons. It's called Collagen Pro Flex Strength System. A system, as collagen isn't the only component of this supplement. So this supplement contains a mix of active ingredients. It's been created for people who want to take care of their physical health, physical fitness in general. The ingredients it contains have got a positive impact on the articulating cartilage in your joints, muscles, and tendons, all of the components of joints. Let me just have a sip of coffee. So let's go quickly through the ingredients. The first ingredient is obviously collagen. Collagen is the key building material for tendons and cartilage, which form our joints. It is a natural, highly refined marine collagen, which has excellent bioavailability. That means it has structure similar to the collagen structure produced by our body. That's why it can be very well absorbed and used by the body's tissue. In addition, the supplement has got vitamin C. So as I mentioned before, vitamin C plays an important role in collagen synthesis, and it can promote proper function of cartilage, bones, tendons, and ligaments. Then there is vitamin D. Vitamin D is extremely important for building strong bones. Vitamin D plays several roles in bone health, including helping your body absorb calcium. The supplement also contains calcium. Calcium is the most important mineral for bone health and is the main mineral found in your bones. Because old bone cells are constantly broken down and replaced by new ones, it's important to provide your body with proper calcium intake daily to protect bone structure and strength. Another very important substance that the Collagen Pro contains is glucosamine sulfate. Glucosamine is a chemical compound that occurs naturally in human tissues. Glucosamine supports healthy joints by preventing the breakdown of cartilage. This molecule has been specifically studied for its potential to treat symptoms and diseases associated with arthritis, rheumatoid arthritis, and also osteoporosis. Multiple studies indicate that supplementing daily with glucosamine sulfate may offer effective long-term treatment for osteoporosis by providing a significant reduction in pain, maintenance of joint space, and also overall swelling of the joint and slowing of the disease progression. You can find this supplement also quite interesting because of the ingredient called bicycle skullcap. It is a strong antioxidant that effectively protects your joints, tendons, muscles, and ligaments from oxidative stress. So let's move on with our 10-step formula. And the next step, number 3, is get plenty of vitamin D3. Just briefly, vitamin D is extremely important for building strong bones. Vitamin D plays several roles in bone health, including helping your body absorb calcium, as I mentioned earlier. Achieving a proper level of vitamin D3 in the blood is recommended for protecting against osteopenia, which is the first stage of osteoporosis, and obviously osteoporosis and other bone diseases. Unfortunately, vitamin D deficiency is very common, affecting about 1 billion people worldwide. So who is at risk of vitamin D deficiency in particular? First of all, there will be older adults. Next, there will be people with dark skin because their skin is not able to synthesize enough of vitamin C. If it's not exposed to enough sunlight, for example. Also, people who suffer with fat malabsorption, they cannot really absorb fat, which is quite essential, may suffer from vitamin D deficiency. And also people who are obese or have undergone gastric bypass surgery. Obviously, that causes some kind of malnourishment. There's another great product that you can recommend to your customers, and that will help to boost your vitamin D levels and deal with deficiency. So the Nutricode Daily Care Vitamin D capsules. This supplement contains extremely high dose of vitamin D3, which is 3,000 international units, IU. The symptoms of vitamin D deficiency in adults include tiredness, aches and pains, and a general sense of not feeling well. You know, very often I meet people who say that, for example, during the winter time in England, they feel achy, they feel as, you know, their muscles are tight and so on. And then when they go on holiday to a hot country during the winter time for a week or two, the pain is gone. And what does that mean? That means that basically they might have been vitamin deficient. So once they exposed the skin to the sunlight, the skin started producing vitamin D. The problem was solved. So yes, if some people, if your customers complain about, you know, pain, aches, that may be a reason. So vitamin D deficiency. So does research support vitamin D as a treatment for joint pain? Let's take a look. I did some research. One study found that patients living with chronic pain who were deficient in vitamin D were the most likely to benefit from taking vitamin D supplements. Another study predicted that adults with vitamin D deficiency who are older than 50 are more likely to develop pain in their hip and knee joints. The study also noted that the pain is more likely to get worse if the deficiency isn't treated. Another study that I found looked at vitamin D levels in people who have rheumatoid arthritis, RA. The study found that most of the participants had low vitamin D levels. The researchers concluded that the low vitamin D levels were a complication of RA. Other studies have conducted that people with RA have low vitamin D levels from their corticosteroid medications. Because they experience pain, they take corticosteroids medications, and that causes vitamin D drop. Let's move on. Number 4 is eat high calcium food. Calcium, as I mentioned earlier, is the most important mineral for bone health, and it's the main mineral found in your bones. Because old bone cells are constantly broken down and replaced by new ones, it's important to consume calcium daily to protect bone structure and strength. So, if your diet is poor in calcium and you are not able to get enough of this mineral from food that you eat, then you may try the Nutricode Daily Care Calcium. So calcium combines with other minerals to form hard crystals, giving bones strength and structure. Almost 99% of body's calcium is found in the bones. A small amount of calcium is absorbed into the blood and used for healthy function of heart, muscles, blood and nerves. Bones act like a calcium bank. If there's not enough calcium in your diet, the body will take what it needs from your bones for use in other parts of the body. So if this happens, then your bone density will gradually decline, and you may be at risk of developing osteoporosis. So very often people say, but I've been okay all this time, so why it happened? Yes, because things related to our health don't happen like that, don't happen with a snap of a finger at once. It takes months and years for them to happen. So now we've got another, so I mentioned the calcium and vitamin D3. So we've got another thing here to consider. So the question is, why should you take calcium and vitamin D3 together? First of all, your body needs vitamin D in order to absorb calcium. That means you won't fully benefit from even a calcium-rich diet or a supplement if you are low on vitamin D. So you can get vitamin D from certain foods such as salmon, eggs, yolk, and some mushrooms, but do we absorb all the calcium we eat from food? Not all the calcium we consume is absorbed. Some amount of calcium will be lost and excreted from the body, which is quite normal. Every day, we lose calcium through our skin, nails, hair, sweat, urine, and feces. So take those two together to take the great advantage of both. It's quite important. Okay, so calcium isn't the only mineral that's important for bones. It's the most important, but it's not the only one. Several other minerals play a role, including magnesium and zinc. Magnesium plays a key role in converting vitamin D into the active form that promotes calcium absorption. So as you can see, everything is connected. So sometimes just taking one, it's not enough. Zinc, on the other hand, is a trace mineral needed in very small amounts. It helps make up the mineral portion of your bones. In addition, zinc promotes the formation of bone-building cells and also prevents the excessive breakdown of bones. Good sources of zinc include beef, shrimp, spinach, flax seeds, oysters, and pumpkin seeds. So remember that you can also take our magnesium forte, which contains 400 milligrams of magnesium. Now, number 6 is consume food rich in omega-3 fats. Omega-3 fatty acids are known, very well known for their anti-inflammatory effects. They've also been shown to help protect against bone loss during the aging process. In addition, although most studies have looked at the benefits of long-chain omega-3 fats found in, for example, fatty fish, one controlled study found that omega-3 plant-sourced omega-3 helped decrease bone breakdown and also increased bone formation. Plant sources of omega-3 fatty acids include chia seeds, linseeds, and walnuts. This supplement that I would like to introduce to you is called Daily Care Omega-3. But Daily Care Omega-3 does not only contain omega-3. It contains omega-3, which contains other fatty acids like EPA or DHA, but also it contains vitamin E, thiamine, vitamin B6, folic acid, and also vitamin B12. But let's focus on omega-3 because we're talking about healthy bones and joints. Okay, and so both EPA and DHA that omega-3 contains have been shown to alleviate some of the symptoms of rheumatoid arthritis, having beneficial effects on swollen and tender joints, grip strength, and also mobility. Omega-3 fatty acids reduce the production of some substances released during your body's inflammatory response. Inflammation is a natural response to infections and damage in your body. So, for example, if there is degeneration in your knee caused by your age, for example, inflammation will be there 100% because that will create the swelling, pain, and redness. Inflammation, if it's not chronic, it's vital for your health. It's vital for the healing process. However, inflammation sometimes persists for a longer time, even without an infection or injury. And this is called chronic or long-term inflammation. Long-term inflammation can contribute to almost every chronic every chronic Western illness, including heart diseases and cancer. So omega-3 fatty acids can reduce the production of molecules and substances linked to inflammation, such as inflammatory cytokines. So studies have consistently observed a connection between higher omega-3 intake and reduced inflammation. So I would definitely introduce this supplement for people suffering from joint pain or inflammation related to joint pain, as omega-3 will help to ease the pain through reducing the inflammatory process going on in a particular joint. Next, number 7 is consume enough protein. Getting enough protein is very important for healthy bones too. In fact, about 50% of bone is made of protein. It's not only important for muscles. Researchers have reported that low protein intake decreases calcium absorption and may also affect rates of bone formation and breakdown. However, concerns have also been raised that high protein diets drain away calcium from bones in order to contract. And that in turn increases the acidity in the blood. So calcium is an alkaline mineral, and so is magnesium and potassium. So if your body becomes too acidic, then those minerals which are stored in bones will be released to bring back the proper balance of acid and base. So nevertheless, studies have found that this doesn't occur in people who consume up to 100 grams of protein daily. As long as this is balanced with plenty of other kind of foods, for example, plenty of plant foods and adequate calcium intake. What's more, diets containing a greater percentage of calories from protein may help preserve bone mass during weight loss. The next point that I would like to mention is avoid very low calorie diet. Very, very low. Dropping calories too low is never a good idea. In addition to slowing down your metabolism, creating rebound hunger and causing muscle mass loss, it can also be harmful to your bone health. Studies have shown that diets providing fewer than 1,000 calories per day can lead to lower bone density in normal weight, overweight, and also obese individuals. As I said, different health processes need time to happen. So it's not an overnight process. One study observed they observed some obese women who consumed 925 calories per day for 4 months, and they experienced a significant loss of bone density from their hip and upper thigh region, regardless of whether they performed resistance training, for example. So that was, the calorie intake was too low, and hence the condition. So to build and maintain strong bones, follow a well-balanced diet that provides at least 1,200 calories per day. It should include plenty of protein and foods rich in vitamins and minerals, because all of that will support your bone health. Number 9, in addition to eating a nutritious diet, maintaining a healthy weight can help support bone health too. For example, being overweight increases the risk of osteopenia and osteoporosis. This is especially the case in post-menstrual women who have lost the bone protective effects of estrogen. In fact, low body weight is the main factor contributing to reduced bone density and bone loss in this age group. On the other hand, some studies suggest that being obese can impair bone quality and increase the risk of fractures due to the stress of excess weight. Overall, repeatedly losing and regaining weight appears particularly detrimental to bone health, as well as losing a large amount of weight in a short time. One recent study found that bone loss during weight loss was not reversed when weight was gained, which suggests that repeated cycles of losing and gaining weight, so-called yo-yo effect, may lead to significant bone loss over a person's lifetime. So maintaining a stable normal weight is your best bet when it comes to protecting your bone health. If you need to lose weight, why don't you try or introduce to your customers our Fit 6 program that will help you lose weight naturally and safely without yo-yo effect. You can watch my previous webinar on YouTube channel about the program. But very soon I'm gonna record another one as well. So what is the Fit6 program? It's an innovative and safe method to lose unwanted body fat. It's created by clinician dietitian. It's amazingly effective without yo-yo effect. It consists of 3 stages divided into 6 steps. It focuses on healthy eating habits and also taking dietary supplements. So if you would like me to prepare a webinar, a training session about Fit6 program, comment under this webinar, under this video. And finally, number 10 is strength training and weight-bearing exercises. Engaging in specific types of exercise can also help you build and maintain strong bones. Muscle contraction puts stress on bone, to which bone responds by becoming stronger. It's like working out your muscles as well. So they contract and become stronger. So one of the best types of activity for bone health is weight-bearing or high-impact exercise, which promotes the formation, basically, of new bone. Strength training exercise is not only beneficial for increasing muscle mass, it may also help protect against bone loss in younger and older women, including those with osteoporosis and osteopenia. So if you or one of your customers suffer from osteoporosis, you shouldn't be afraid to do exercise, because in contrary, it's not gonna detriment the health. In contrary, it's going to help build strong bones. So here's the conclusion. Bone health is definitely important at all ages of life. However, having strong bones is something people tend to take for granted, as symptoms often don't appear until bone loss is advanced, like with osteoporosis. Fortunately, there are many nutrition and also many supplements that you can take in order to look after your bones. So if you or your customers would like to take care of their bones and joints, for example, due to their age, because the bone health deteriorates due to their age, or they don't have a good diet, we can offer them 2 options. Let me just quickly, I need to just connect my laptop charger. Yes, so going back, 2 options. So option number 1, they can start taking our Nutricode Collagen Pro Flex Strength System. Plus, in addition, I would recommend taking omega-3 and also magnesium forte. Or the second option, if they don't want to take the Collagen Pro, they can also take other supplements to keep their bones and joints healthy. Then I would recommend liposomal vitamin C, vitamin D3, calcium, and omega-3, and in addition, magnesium forte. So here we've got like 2 options that can be recommended. Also, when you take those supplements, you're not only looking after your bones and joints, you also take care of the whole body, because those supplements contain a variety of substances that will also affect other aspects of your health. So thank you very much for today. I hope that now you have a better knowledge about bones and joints and our Nutricode supplements that can help maintain healthy bones and joints. So please remember, subscribe to our YouTube channel to get the latest notification about other Zoom recorded training sessions. And that's it for today. So thank you very much for joining me. Please comment below with any suggestions that you may have in terms of other training sessions. Let me know if you want me to prepare a webinar about our Fit6 program. If yes, what exactly would you like me to discuss during the webinar? And thank you very much. See you again soon.